PHN undertook a needs assessment last year, and one of the I suppose concerns that come out of that was the lack of workforce in the Aboriginal health worker sector. So we decided what we wanted to do was address that need, and this is why we're here today. So we have about 20 Aboriginal people from all over the Hunter New England Central Coast area to undertake the Certificate 3 in Aboriginal primary health care.
I'm really passionate about health, and when I heard about this course I sort of saw it as I suppose that I'd be able to get out in the community more.
I do like helping people, and I find a lot of a great sense of achievement out of helping somebody. Yeah, I'd like to help start something else that's gonna progress everyone forward to moving into a healthier sort of future too.
I've always wanted to get into health to I suppose give better education and support to Aboriginal communities to bridge that gap, to close that gap. I've recently just had a big lifestyle change myself, so gave up smoking, diet and exercise. That actually came about because I broke my leg, and then I started also with my generation, my aunties, my mother all have diabetes, so I wanted to make a change for better, and then also want to do that with the rest of my family members.
I've got a lot of elder family members that are going through health problems, and I've noticed that it's becoming a higher demand, so I'd like to give back to my community.
I'm doing this course because I'm passionate about my culture and my people. I'm hoping to learn a bit more about health in Indigenous people and the outcomes that we can find or provide to better our lifestyle.
So at the end of this course, what we're hoping to achieve is to place the students into general practice. With our stats and our data have indicated that there are a lot of people that access the community controlled sector, but there's also majority of Aboriginal people that access mainstream general practice. So the way to combat that, to ensure cultural safety within those practices, is to place Aboriginal people into those practices and be sort of a cohort between mainstream and the Aboriginal community, and teaching the general practices how to work with our people.
My goal would be to educate non-Aboriginal people as to why sometimes Aboriginal people don't like presenting at doctors or the hospitals. I think a lot of people just need to be educated about their health too. People not just saying, oh, you've got diabetes. Really explain it to them, and the preventative measures that they can take, and just give them other options than they're normally got.
It's a great opportunity offered to me, and all the other peers in the class, and it does sound like a lot of work, but if you put that work in, you can get a lot out of it in the long run, and it is a great career option.
That's one of my main reasons also why I wanted to get into the course, is that I've always wanted a career where I've wanted to give back to community, especially the Aboriginal community, to better our chances to close the gap, to bridge and to break down all the barriers. So I think that's important, to get our young ones educated and in qualified roles, to then make that a cycle of life to help each other out.
Well, in my area the Aboriginal population's a bit high, so I feel like Aboriginals working with other Aboriginals would make more of a connection, more of a trust barrier, if you will, or break down barriers for trust.
What I'd honestly say is that if you do get the chance to take on this qualification, it is a really good qualification. The class and the teacher is great. It's a great environment.
All of us have built friendships and support networks, and the teacher's really great, and everyone gets to discuss things. That's what I like about it. It's good learning.